Welcome one and all. Welcome to the 21st Incofyra International Conference on Frontiers in Yoga Research and Applications. This is Symposium 3 on the topic of cardiology in the venue Vivekananda Hall. Now, I would like to welcome Professor Alex Hankey. He is a distinguished professor of S-VYASA University. And our speakers are Professor S.C. Manchanda. I welcome you, sir. He is a senior consultant cardiologist in New Delhi. Now, next is Dr. Ram Manohar. He is the director of AVP Research Foundation in Coimbatore. And Dr. Geeta Krishnan, Department of Integrative in Kerala. Welcome you, sir. Now I would like to hand over the program to Dr. Alex Hankey.
Good. It's a great pleasure to be with you here today. We all know that cardiovascular disease is among the most important non-communicable diseases that has to be resolved for mankind because it has been the chief killer for many years. This afternoon's session focuses on a topic very close to my heart, the resolution of cardiovascular disease problems by complementary systems of medicine, for which meditation has been shown to be extraordinarily effective, and we've had presentations on yoga this morning in the main venue. So this afternoon we shall start in this session on Ayurveda and cardiovascular disease and problems with a presentation from Dr. Ram Manohar. We have a very distinguished series of speakers. Dr. Ram Manohar, my dear friend Dr. Geeta Krishnan from Medanta Hospital in Gurgaon, and Professor Manchanda, who is a senior consultant cardiologist in New Delhi. So let us start with Dr. Ram Manohar. Research director was, sorry? I had Dr. Ram Manohar as the first speaker on my list. I don't mind who speaks first. If Professor Manchanda would like to speak first, that is excellent. Professor Manchanda, Subhash C. Manchanda, is a consultant cardiologist with many professional qualifications, a DM in cardiology. He's senior consultant in the Department of Cardiology at the Sri Sir Gangaram Hospital in New Delhi. He was formerly professor and head of Department of Cardiology at AIIMS, New Delhi. He has over 45 years of experience in professional teaching and research. He's a recipient of several national and international awards, including Padma Shri and by the President of India, and a Lifetime Achievement Award by the Cardiology Society of India. He's done a great deal of research in various fields, and he has over 400 scientific papers published in various national and international medical journals. Professor Manchanda.
As you heard, I am an allopathic physician. I am a cardiologist who has been practicing cardiology for the last 45 years, but have been interested in the management of cardiovascular disease by alternative methods, that is yoga. And a lot of research also, because the medicine that I practice, allopathy, is evidence-based. And therefore, we were looking for the evidence, and I would be showing you some of the evidence-based uses of yoga in the prevention of cardiovascular disease. You have already been told that cardiovascular disease is the leading cause of death all over the world, Actually, 31% of people throughout the world die because of heart disease, and another 27% die of similar related diseases called lifestyle or non-communicable diseases. And this is the biggest burden of the disease, which in spite of all the progress in super specialties that we have, like angioplasty, bypass, cardiac transplant, we have not been able to check because they are related to lifestyle. Earlier it was considered that heart disease is a disease of the rich people. But you see the map here, and this is, you would see that this is present throughout the world. The poor countries actually are having quite a lot. You can see this red shade. Even in Africa you get it. In India, as you know, we are the diabetic capital. We have a huge number of people. India and China and South Asian countries are going to have 80% of the disease. Actually, it started in the rich people, then went to middle class, and now it is a problem of the poor people. In the United States and Europe, it is the poorest of the poor who are getting it. In our country also, initially the rich people, now the middle class, and even many poor communities are getting it. I move all over India, I see rickshaw pullers and others also getting it. So it's a disease of the poor people, please remember, and it's a costly disease. In India, the situation is not different. These are all the non-communicable diseases which constitute about 70% of all diseases, and heart disease is again leading killer here. Almost every third person dies of heart disease. And for some reasons, Indians are most prone to get this disease. This is an international data of the immigrants who are settled either in England or in, the immigrants who are settled in United Kingdom, United States, Singapore or South Africa. Indians have the highest death rates. Even if you see the epidemiological study on the left side, you will find that Indians, whether they're settled in Delhi or in Chennai or in United States, they have 4 times higher than the United States population. There was a Framingham study, a study which showed that the prevalence of heart disease is only 2.5% in the United States. In India, it is already crossing 10%. So we are for some reason most prone to get this disease. We have the highest disease even if we go abroad, and as compared to all immigrants, whether it's Chinese or others, we have this disease 3 to 6 times more common. So being an Indian is a risk factor. And many people say that disease is not increasing, it's the awareness. But that's not true. You see, this is data, although it's a very limited data from 1960 to 95. In 35 years, the disease has increased 5 times in the urban population and has increased 1.5 times in the rural population. So 2 things are very clear, that it is a disease of the urban population. It is a disease when the lifestyle becomes abnormal. And even in the rural population, it is increasing, although it is much less. So it is a disease which is really increasing, and from 95 onwards, it is going to increase still more rapidly. It is expected that it will double in the next 20 years. Another problem of cardiovascular disease in India is it occurs at a relatively young age. You see, in the Indian context, 52% people get it at a relatively young age, as compared to the Western countries where 23% get it. So it affects the people at a very young age. I have seen people getting heart attack in my country as young as 20 to 30 years. Actually, 40% of our patients have disease below the age of 40 years. So this is another problem. And not only the deaths are very, very high, but also the loss of productive years, that is disability adjusted. Disadjusted life years are maximum in the developing countries. So although India is progressing economically, but look at health-wise, we are really suffering a lot, because you can see the amount of productive years which are lost, which is huge amount, and therefore it's a very, very costly disease. You can see this is a WHO data which shows that in 10 years, India has spent $236 billion as compared to other countries. Canada has spent very little, and so whatever we are actually earning is going into the drain because of this costly disease. So in spite of all the advances, the disease is increasing, it is draining a huge amount of money, and this is what is projected, that what is going to happen? This disease is going to increase throughout the world. The developing countries like Brazil, China, and India is going to increase by almost 200%. Already, as I said, it's a very common disease in our country. Every year, 25 lakhs people, 2.5 million people die every year, 5 people dying every minute. In the next 20 years, it is 25 years, it's suspected that it will increase by 170%. So this is a very bad scene, and we have to do something about it. This is in spite of all the advances and all. But what are the causes? If you know the causes why it increases, maybe we can tackle it. There are demographic changes. The life expectancy has increased. You know, life expectancy in India used to be only 32 years in 1947. Now it's become 65 years. That's a very good thing. But as the age advances, the diseases really occur more frequently, but not necessarily. In, for example, Japan, the life expectancy is 83 years. There is very little disease. The main factor is the lifestyle changes. The stress, the diet, tobacco, lack of exercise, all of you know that. And there is some genetic predisposition also, which is, I don't think is very important, because in next 20 years, disease is going to double, but genes are not going to change. It is not genes which are abnormal, it is genetic expression. My colleagues in the United Kingdom have done a lot of work, and they think epigenetic is defective. It is not the genes. Genes are the same. Gene expression is changed, and therefore, all these things can be controlled by yoga. These are some of the lifestyle risk factors for heart disease, and that is diet. If you take diet which is high in fats, you get high cholesterol, you get hypertension related to diet, again too much of salt, diabetes, too much of refined food. Hypertension, as you heard yesterday, is the commonest cardiovascular problem. Diabetes is very, very common in our country. We are the diabetic capital, and obesity is increasing. All these are related to diet. Then there's lack of exercise, which people, when they come to the cities, they get it. Mental stress is a very, very important. It's written as third, but it should be number one. And tobacco consumption. Of course, there are environmental pollution also, which is not in our, it's not written. And I will try to show you that yoga can control all these risk factors. Now, yoga, you are all experts. When I started my project, this is what I had to tell my patients. They said it's very difficult asanas. When you make a person 70 years who has knee replacement do yoga, it was very difficult to convince them. So we had to tell them that, hey, you all know that better than I. Yoga is not a few postures or asanas, but a complete way of life. It's a practical, universal discipline irrespective of culture, nationality, race, caste, age, sex, and physical condition. It aims at harmonious development of the body, mind, leading to physical well-being, mental harmony, culminating into positive thinking, happiness, and peace. And therefore, I use this term yoga lifestyle. This we used in our first paper that we published about 20 years back. It consists of physical, mental, emotional, and spiritual well-being. These are the 4 components of yoga. That in the physical component, sattvic diet, a diet which is similar to what we tell our heart patients, which avoids heart disease and diabetes. Physical exercise is a part of yoga, and no addictions like tobacco and alcohol. So this is a physical component. I think there's no differences between the allopathic system and yoga is an extremely good method of mental well-being, and this is achieved by meditation. Huge number of studies are there. I don't have to go into details, which show that stress can be managed easily by meditative practices. It's an excellent method of emotional well-being. For example, anger, ego, jealousy, hostility, all of them have been shown to cause disease. I have seen people dying of anger, people dying of jealousy, and so on, getting heart attacks and so on. And the positive emotions like compassion, love, prevent the heart disease. And again, spirituality is a part, and being spiritual also decreases heart disease. Now, there are so many systems of yoga. When I started, they said, which one should we follow? It's Art of Living or Ramdev or whatever. And these are taken from this, Ashtang Yoga. These are the 8 disciplines, Yam, Niyam, Asanas, Pranayam, Pratihar, Dharana, and Dhyan and Samadhi. All these systems, there are more than 120 systems of yoga and meditation, all derived from this. Some people stress a lot on these asanas for Iyengar yoga. Some people talk a lot of pranayam, this Art of Living and Ramdev, etc. Some people talk only of meditation, Raj Yoga, for example, transcendental meditation, etc. But whichever method you use, I will show you, the research studies show any method you use, even meditation alone, the benefits are almost similar, as I will show you with the research studies. Therefore, yoga is nothing but a holistic and intensive lifestyle modification consisting of stress management, healthy diet, regular physical exercise, and avoidance of tobacco. I like to call it a lifestyle polypill. These are the 4 factors which cause heart disease, so it should be really useful. Yoga has been claimed to be beneficial in so many conditions which you have heard for the last 3 days. Anxiety, depression, extremely good. For mental peace, happiness, extremely good. Bronchial asthma, the first paper came from this center long back. It is extremely good for physical fitness, we heard this morning from Dr. Shirley. Irritable bowel syndrome and ulcerative colitis, my colleague from All India Institute have shown this very clearly. Several joint pains, both immunological and osteoarthritis, and most important is cardiovascular disease. So I will be talking about cardiovascular disease. You see, what is cardiovascular disease? Cardiovascular disease is nothing but a continuum. It starts with some risk factors. For example, if a patient has high cholesterol, he has high blood pressure, diabetes, smoking, he has stress, he will develop what is called as inflammation, oxidative stress. And inflammation and oxidative stress causes atherosclerosis, which increases over a period of time, causes angina when it's blocked 70%, and heart attack when it is more than 100%. Heart attack can lead to deaths, it can lead to irregular beats called arrhythmias, it can cause heart failure and ultimately death. Yoga has been shown to act at all these levels. You see, you'll be surprised, there is data to show that it is extremely useful for control of risk factors, all the risk factors that have been named. It's extremely good to decrease the oxidative stress and inflammation. I will not have time to go into details of all that. It is extremely useful for reversal of early atherosclerosis. I will show my study which has shown that. In myocardial ischemia, if the advanced blockages are there, it can improve ischemia, decrease coronary blockages, and then it can even prevent myocardial infarction. One study is available, and then it's extremely useful for arrhythmias and congestion. So at every level, yoga can interrupt this chain and therefore could be useful. But where is the evidence? The evidence is huge, and it's not possible for me to cover up all this, but huge number of studies have shown these are randomized controlled trials, extremely useful for hypertension, so much so that even American Heart Association accepted it. I'll talk about that in a minute. Diabetes mellitus, we were having a full session for the last 3 days on diabetes mellitus. Enough evidence to show it's extremely useful, especially pre-diabetes and metabolic syndrome. We'll show you some data that we have. Obesity, you heard this morning. Dyslipidemia is an independent, decreases the LDL, the triglyceride, increases HDL. Large number of studies are there, and it is extremely good for cessation of tobacco, and of course the best method for mental stress. But the maximum data is on hypertension. There are actually, if you see the world literature, you would find that there are 7 meta-analyses which have appeared in the last 1 year itself. And even American Heart Association, the biggest association of cardiologists in the United States, has accepted. They reviewed all the data available on yoga meditation. They accepted that meditation can reduce blood pressure. They talked mostly of transcendental meditation, but as I said, all meditations are equal. Hence, the American Heart Association, the biggest association of American cardiologists, that meditation should be used as a non-pharmacological technique to control blood pressure in patients with mild hypertension or pre-hypertension. So this is accepted. This is published in one of the leading journals of allopathy, that is hypertension. So it is already come in the mainstream. We have done studies that it can reverse heart disease. There are 2 types of heart disease. One is early atherosclerosis, and you heard a lot from Shirley tell us about this type of problem that we have. This is called metabolic syndrome. Indians are very obese in their Midwest. This is called central obesity. This is associated with diabetes, high blood pressure, dyslipidemia, and heart attack. A very, very dangerous situation, because the fat which accumulates in the visceral area is very pathogenic, and it is very active. It causes heart disease. There are more than 50% of Indians have this problem, and these people are asymptomatic. They come to the health checkup, and we took 100 of these patients, and half of them we trained yoga for 1 year, and the other half we did not. We gave them the usual lifestyle methods, and this is what we found at the end of 1 year. You see on the left side in the control group who were not doing yoga, the increase in the thickness of the arteries. It's called carotid intimal medial thickness. This is a surrogate marker of earlier blockages or atherosclerosis. We did show that it has increased in the control, and in the yoga group it decreased significantly. So early atherosclerosis can be reversed. This was the only study of its kind which shows that in people who are asymptomatic, heart disease, asymptomatic disease, and it was shown that it can decrease it. In addition, you see that this was a randomized controlled study. There was a decrease in the body mass index. The waist circumference decreased. The central obesity decreased. HDL increased. The LDL, HDL is a good cholesterol which increases good. LDL is a bad cholesterol decrease. And the blood pressure also decreased much more than in the control group. This has been published and in one of the American journals. And this clearly shows that 1 year of practice can control one of the most dangerous situations that Indians have, that is metabolic syndrome. Others have shown that insulin resistance can also improve. You heard from Shirley Tellis. She has also a series of articles to show that it can be reversed. So this is extremely useful because in patients who are not symptomatic, but even if the patients have advanced disease, for example, if they have blockages in the arteries, and there are 3 studies available. Dean Ornish started in 1990 and he followed this up for 10 years, and this changed the whole thing. He called it lifestyle heart. He did not use word yoga because it was not allowed at that time in 90. We did for the first time a study called Yoga Lifestyle Trial, in which we gave yoga for 1 year to these patients as compared to control. And our study was different from Dean Ornish because Dean Ornish has used patients who had 40% blockages, very small blockages. Our was the only study more than 70 years, more than 2 or 3 arteries were blocked. And then there was recently a trial, Raj Yoga, using Raj Yoga meditation, which is only meditation of Brahma Kumaris. All the 3 trials have shown similar results. This is what I'm trying to share. Whatever method you use, in all these trials what we found is the body mass index decreased, obesity decreased, the lipids, cholesterol came down markedly. None of the studies use statins here. Our study was done before statins were allowed earlier, but the study that we have done with the metabolic syndrome, statins was used. In addition, yoga can also decrease cholesterol. Angina markedly reduced by 70%, and even treadmill test showed improvement, thallium showed improvement. Angiography was done in all these studies and it showed regression by 7 to 8%, which is quite significant. As psychosocial stress improved and the compliance was more than 80%. This is most important part of the study because in the Western literature it is said lifestyle is very difficult to change. People are told change your diet, do exercise, then don't do it. Leave aside yoga. And the reason is, I think, weak mind. And what we found and what we all of us have shown that if the mind becomes strong, that which happens with yoga, the compliance with diet and lifestyle is much better. Then, as I said, it has now come up in the mainstream in the cardiology. Circulation is one of the top journals, and this is my friend Dr. Schneider, who has done a lot of work on transcendental meditation. This is, I call it a landmark study. This is secondary prevention. These are patients who had heart attack, and they were given meditation and followed for 8 years. This is again a randomized controlled study. You see that transcendental meditation, it was taught to these people in comparison to health education. There was a 48% reduction in repeat heart attacks and deaths. So this is better than any drug. All these patients were taking the usual drugs which we give after a heart attack. So for secondary prevention, the only study which is 7 years follow-up, 8 years follow-up has shown there could be as much as 50% reduction in another heart attack. So all patients after heart attack, after angioplasty, at least I am suggesting, and we are doing a very large study also. This is the only study which shows that it is possible. Can it be used for cardiac rehabilitation? You heard cardiac rehabilitation is one of the most useful methods in decreasing mortality of patients who have had heart disease. But it's not used. In India, hardly used. Other parts also very little used because it's a very costly thing. Yoga being a method of improving physical, mental, emotional, spiritual well-being could be extremely useful. It also reduces all the risk factors like cholesterol and hypertension, stress, tobacco. So it is ideally suitable. And we have have started a large study. Small studies did show that it is useful. One of the studies which was published last year from this group here, S-VYASA, this was a randomized study of 250 patients who had bypass surgery, and they were asked to follow with yoga, and they showed that ejection fraction improved, the sugar improved, LDL improved. In addition, they had marked reduction in perceived stress, anxiety, depression, negative stress. So this is an extremely good study which shows that all patients, even if they had a bypass or angioplasty, they must have this, and there is evidence which is published. And many people, many hospitals in the world are now calling patients before bypass surgery a day or two earlier, teaching them meditation and following them with meditation, and the results have been very positive. Now, what about arrhythmias? This is a study from United States. Dr. Dhananjay Lekha Reddy, who is one of the top electrophysiologists, he showed that yoga can decrease atrial fibrillation. Atrial fibrillation is irregular heartbeat, which is the commonest arrhythmias in the whole world as the population is aging, and this is responsible for what we call as strokes or paralysis. These patients were given yoga, and after 3 months they found that the symptomatic atrial fibrillation episodes, even asymptomatic episodes, decrease markedly. If this is true, then this is a great breakthrough, because you can reduce it by 30%. Now we use very, very costly drugs and so on once a person develops atrial fibrillation. This is, of course, it has to be repeated. This is only one study, but very encouraging. Similarly, studies are available which shows that ventricular ectopics, the premature ventricular beats, can significantly decrease. There are several studies in heart failure also. A 12 weeks practice of yoga has been shown to improve left ventricular ejection fraction, peak O2, oxygen consumption, and quality of life. In addition, there is a weight loss, improved mood, and decreased inflammatory markers. So all these studies do suggest that yoga is acting in almost all levels of cardiac diseases. But what is the mechanism? That's not very clear. It has been suggested by Dr. Innes that it works through two pathways which are acting jointly. For example, one pathway reduces stress. It reduces the sympathetic drive, and it acts through the hypothalamus pituitary adrenal axis, and the other is by vagal stimulation, causing an increase in heart rate variability, increased baroreceptor, inflammatory markers, and heart rate, and so on are decreased. All these things ultimately decrease oxidative stress and reduce atherosclerosis, hypertension, arrhythmias, and heart failure. So this may be a mechanism, but I think this is very well known that now yoga can act at every level. So to conclude, friends, I have tried to show yoga is not a few asanas. It's a holistic lifestyle. It is possibly the best lifestyle ever devised. I have called it as a lifestyle polypill because it covers all the 4 aspects of unhealthy lifestyle. That is, diet control can be done, exercise can be done, stress control, and tobacco control. So this is one of the best lifestyle ever devised. There's a lot of scientific research shows that yoga has preventive, promotive, and therapeutic role in heart health. I have shown you the data of primary prevention, controlling the risk factors. I have also shown you that it can have therapeutic role. Early atherosclerosis can be reversed, and even advanced and arrhythmias, etc. I have not shown you certain other things like inflammation and oxidative stress, but there are small studies are there. Risk factors of heart disease like hypertension, diabetes, mental stress can be controlled by yoga lifestyle, and yoga can even reverse heart disease. Early atherosclerosis and metabolic syndrome, I have shown you our own data, can be reversed. It can control arrhythmias, atrial fibrillation, ventricular ectopics, and heart failure. Of course, there are several studies, but all these studies have several limitations. And because small samples, some of them are not randomized, the quality is not very good, and therefore large multi-central trials are required. We are doing one such trial, Yoga Care. You heard from Dr. Prabhakar, which 16 hospitals in India with UK help. We are trying to do such studies, and the centers like this are trying to do. But already it is accepted, as I said, by American Heart Association that it can be used for control control of. So it has come in the mainstream. You see it's being published in most of the leading journals of cardiology. And in spite of the fact that limitations of the studies, yoga being a simple, cost-effective, safe strategy, it can decrease the burden of heart disease throughout the world, because prevention is the answer, and treatment of this costly disease is just not possible, I told you. And therefore many hospitals have accepted it. For example, I work in Gangaram Hospital. Earlier I was in All India Institute of Medical Sciences. We have a yoga lifestyle clinic, a small room where a yoga teacher is teaching patients who come to the hospital to control ischemic heart disease. Many times we do angiography, artery is 30% blocked. These patients, I say, are maximally benefited if you control the risk factors: hypertension, diabetes, obesity, dyslipidemia. And for rehabilitation, for stress management, control of anxiety, depression, learn meditation, lead a happy, stress-free life, and special sessions for staff and doctors. So this is the real integration. You see, I will call it integrative. If so-called the allopathic tertiary care hospitals accept this, and many of the hospitals have accepted it, and this could be used in combination both for primary prevention as well as secondary prevention. And because of its health benefits, you know, yoga is becoming popular throughout the world, and especially the cardiologists have accepted it in the mainstream. Thank you very much.
Regulating and controlling heart disease, cardiovascular disease through yoga.
I would like to call upon Dr. Alex Hankey to hand over the token of love to Dr. M.C. Manchanda. I would like to ask Dr. Alex Hankey to introduce the next speaker, Dr. Ram Manohar.
It's a great pleasure to introduce to you my good friend, Dr. Ram Manohar, who is currently Research Director of the Amrita School of Ayurveda in Kollam, Kerala, having not so long back transferred from his position as Research Director at AVP in S-VYASA Pharmacy in Coimbatore. Dr. Ram Manohar has a tremendous record of work popularizing research, promoting publication, promoting awareness of Ayurveda research in different journals. He has done a tremendous amount leading from the front Ayurveda research in India. He received his BAMS from Bharatinaam University, Coimbatore, and MD from Rajiv Gandhi University, Bengaluru. He was the principal investigator of the NIH-sponsored study to evaluate the efficacy of Ayurveda in rheumatoid arthritis in collaboration with the University of Washington, Seattle, University of California, Los Angeles, and AVP Coimbatore, under the leadership of Professor Daniel First, Professor of Rheumatology at UCLA, as I remember. It was an epoch-making study, and it introduced for the first time valid placebo controls using pseudo-Ayurvedic medicines. The outcomes of this study were published in the Annals of Rheumatic Disease and the Journal of Clinical Rheumatology, and won Excellence in Integrative Medicine Research Award from the European Society of Integrative Medicine. Dr. Ram Manohar has established online indexing service for Ayurveda research papers called Dara. He has served as principal investigator for many research projects. He has 20 research publications in peer-reviewed journals and contributed chapters in several books. He serves on the editorial board of many journals. He was honored with the Ayurveda Marga Pravartaka Award by Mahadevan's Ayurveda Foundation in 2014, and Vaidya Sundarlal Joshi Smriti Sudha Puraskana by the Maha Gujarat Medical Society in 2015. It's a great pleasure, Ram, to see you here. Please welcome him. Let's have a big hand for Dr. Ram Manohar.
Thank you very much, Dr. Alex. Thank you for that warm introduction. And my pranams to all the dignitaries and the delegates who have come to attend this wonderful conference. So after the very enthralling introduction by Dr. Manchand about the possibilities of yoga for management of heart disease, and especially it's heartening to see how yoga is getting integrated into mainstream medical practice, I would like to focus upon what is the scope for Ayurveda and cardiovascular diseases. And before I get into my presentation, I'd like to mention that I'm basically a researcher, and my focus is on doing good research in Ayurveda. And so that is how cardiology becomes one of the areas into which we are venturing at the Amrita School of Ayurveda. There's a serious preliminary steps have been taken to develop integrative cardiology incorporating Ayurveda, modern medicine and yoga together. And it'll be a little while before the results are published, but what I'm going to do is a kind of a research review. Like, what are the gaps, what are the possibilities, is more to generate the interest in exploring Ayurveda as an option for cardiovascular disease, why we should do that. And to begin with, I think when we look at systems of Ayurveda, traditional medicine like Ayurveda, we need to look at what I would call the evidence triangle. I mean, we need to look at Ayurveda itself in a comprehensive manner. On the one side, we have the textual sources, which are codified knowledge, existing for thousands of years. And then the traditional practices on one side, which have also been in vogue for many centuries. And then scientific research. So, irrespective of what speciality we are looking at, this is a kind of approach that we need to adopt to get a more balanced and complete understanding of what is the scope for Ayurveda to contribute to cardiovascular disease. So my discussion today will also have 3 sections. We first look at the textual sources, then the clinical practice, and then scientific research. What evidence is available, what are the gaps, and what are the directions that we should take to move forward. So I would say when it comes to cardiovascular disease, research is still in its infancy, and although there's a lot of hope and promise and potential, we really need to do what we can call as a high impact landmark study demonstrating, in a very convincing way what Ayurveda can do for cardiovascular diseases. With respect to some other disease, we already have such landmark studies, but for heart disease, we still do not have. So, on the one hand, we have to look at what contributions Ayurveda can make as an independent system of medicine, but it's also, I think, more important because in complex diseases like heart disease, an integrative approach, I think, is much more relevant than just looking at what Ayurveda can contribute as a standalone system. So we need to look at what are the levels in which Ayurveda can get integrated, on the one hand with yoga, and on the other hand with modern medicine. And I think Ayurveda is kind of an interface. Yoga is on one extreme and modern medicine extremely drug-based, physical interventions, and yoga very mind-based, higher level intervention. Ayurveda is kind of the perfect interface that can bring these things together because Ayurveda has both these components ingrained in it. So I think there is a real bridging needed to bring modern medicine and yoga together, and Ayurveda is kind of that perfect interface. So my discussion is looking at Ayurveda as an interface to bring yoga and modern medicine together. So now let's look at the textual sources. This is just for the kindling the curiosity and interest in those who may not be aware of the rich knowledge that is already there in the Ayurvedic texts, that there are interesting perspectives that we still can learn by, looking at the classical texts on the functions and, the involvement of the cardiovascular system in disease causation. So the heart and the blood vessels have been described in the classical Ayurvedic texts, and much of this historically is yet to be recognized, like Ayurvedic contributions in understanding the functions of the cardiovascular system itself has not been well recognized. So I just want to spend a little time on this before we go into the practice and the research, because it gives a backdrop idea of what is available in Ayurveda as a system. So heart is considered as one of the three vital organs. It's called as one of the three marmas, the three tripods of life. And interestingly, in Ayurveda, even in the treatment of cardiovascular disease, this is a big difference. I mean, Ayurveda considers heart as rasa, which is different from blood. And this makes a lot of sense today when we talk about metabolic syndrome, hyperlipidemia, all as factors of, causative factors of cardiovascular disease. Rakta as a dhatu is not so much involved. But when we look at it as rasa dhatu from an Ayurvedic point of view, the whole disease pathway of cardiovascular disease assumes much greater relevance. So I wanted to just highlight that in Ayurveda, it was not blood that was circulating. Actually, it was rasa, or the nutrient fluid, that was circulating, and blood was just going along with it. The blood cells do not diffuse out of the capillaries. So it's only the rasa that actually circulates. So, and Ayurveda was one of the earliest systems which talked about circulation, and this is actually not blood circulation as such, but rasa circulation. And the Ayurvedic texts have distinguished between Sira, Dhamani and Srotas. Sira being a vessel in which blood flows passively, Dhamani a vessel in which rasa flows actively, and Srotas through which rasa oozes out. So these functions have been kind of very clearly distinguished. And a very old textbook which is available only in fragments has also talked about circulation of rasa, that it moves out of the heart and returns back to the heart. And some time ago, a paper was published in the Journal of American Physiological Society, which discussed about the contributions of Ayurveda in understanding circulation. So this is just to point out that even if you look at the textual sources, there are many interesting things that are waiting to be rediscovered. Because Ayurveda has been around for quite some time, but it's only recently that from a modern medical point of view, a research journal was willing to publish, on the Ayurvedic contributions in understanding circulation. So now let's come to understanding of cardiovascular diseases in Ayurveda. In Ayurveda, we have 5 broad categories of heart diseases, which are kind of disease pathways. I mean, they are not specific disease entities, but they represent pathologies under which many of the diseases that we understand today could be grouped. And broadly, they are Vataja, Pittaja, Kaphaja, and then Sanipataja and Krimija. And the Vataja type of heart disease covers degenerative conditions like valve prolapse, dysfunctions like arrhythmias, congestive heart failure. Pittaja type of disease covers inflammatory and infective afflictions of the heart, whereas the Kaphaja type of heart disease covers structural problems like obstruction. Now, if you look at the clinical practice, coronary artery disease, valvular heart disease, hyperlipidemia, heart failure, cardiomyopathy. These are some of the conditions in which we have been consistently getting reports of success from the Ayurvedic community. So I want to here distinguish between what is there in the text, what is there in actual practice, and what has been scientifically evaluated. I mean, this is what I want to distinguish in the course of our discussion. And I want to say that when it comes to clinical practice, it appears that the impact of Ayurvedic treatment. There are successful Ayurvedic practitioners. In fact, we also have some centers exclusively for cardiology. I mean, Ayurvedic physicians are treating just heart diseases. So even at that level, there are people contributing. But from the previous talk, we know that this impact is very insignificant. I mean, even if Ayurvedic physicians are treating patients, they are in very small pocket areas, because we have not been able to really make a big impact on the statistics or the outcomes of cardiovascular disease. So it's mainly because these are all anecdotal accounts, but we'll go a little bit more into detail. Now, angina pain was also described in the classical Ayurvedic texts, and it's very interesting that Sushruta explains that when the rasa dhatu becomes viscous under the influence of kapha and pitta, it causes shooting pain in the chest region and severe breathlessness, and this is called as hritshula. And here again, the pathology is considered as based on rasa dhatu, which is what I wanted to highlight, and the whole treatment is on cleansing or clearing up the rasa dhatu. So if you look at experience from traditions and clinical practice, we know that modern medicine has come a long way in the management of cardiovascular diseases, especially emergency management, angioplasty, bypass surgery, pacemaker, and even heart transplants. The developments are mind-boggling. And also we have powerful drugs. But there are gaps left by modern medicine, and the escalating costs of medical care are also of much concern. So I just wanted to point out where the integration is actually meaningful. While acute treatment and secondary prevention is prolonging lives by a few years, the severe impact on mortality due to cardiovascular disease remains unchanged. I mean, this is the biggest limitation of modern medicine. I mean, the acute management and secondary prevention is helping people to prolong lives, but people still succumb to the same disease. I mean, there's no change in the severity of impact. And this is where I think systems like Ayurveda and yoga have a big role to play. So Ayurvedic practitioners have reported success in secondary prevention of coronary artery disease. Preliminary examination of such reports suggests a strong potential for reversal of disease. And this is where I think Ayurveda can serve as a bridge. Even Dean Ornish's lifestyle method, it takes some time to develop that mindset in which you can really with strength change your lifestyle. And this is the biggest difference the challenge when we move from modern medicine to yoga. There is a big gap. There is a transition that is needed. And that is where Ayurvedic treatment offers this package of transitioning from a very drug-based, method of intervention to something which is more lifestyle-oriented. But there are experiences which show that if Ayurvedic treatment is also taken along with lifestyle and diet, then with lesser intense lifestyle changes, you are able to get better outcomes. I'm not speaking in favor of less lifestyle interventions. I'm only talking about transition, because it takes time for people to get counseled and established in yoga and go to a higher level. And so this is one potential area where Ayurveda can contribute. And then primary prevention of coronary artery disease, especially in cholesterol and metabolic syndrome. There are specific dietary, I'm not going into the details. Ayurveda has a wealth of knowledge about diets, which are including even what we call as viruddhahara, combinations, prakriti-based diets. The same people, we cannot prescribe a standardized diet for everyone. And this is one strong area where Ayurveda has. So this is another area I want. Already diet and lifestyle has been shown to be effective. But Ayurveda can fine-tune this knowledge, which is special knowledge on, peculiar actions of food articles, their combinations, which is also understood in terms of constitutional differences, also geographical differences. So that fine-tuning of the dietary and lifestyle regimens, I think Ayurveda has a tremendous contribution to make. Because today what we get is a standardized diet and lifestyle regimen, more or less. So that Ayurveda can make it more powerful. And there are also herbal medications. Many of them have shown promises, but the biggest problem has been that when it comes to research on Ayurveda, people always look at only the drugs. I mean, we don't look at Ayurveda as a complete intervention. the drug is only one component of the Ayurvedic treatment. I mean, the drug to be effective also depends on diet and lifestyle. That is the difference between an Ayurvedic drug and an allopathic drug. In a research setting, you take only Google and then try how it is working. But that's not the way it is actually practiced. So this is one reason why, even though a lot of herbs have shown promise, the way they have been tested and integrated into clinical practice has been extremely limited. So certain other areas where we get a lot of anecdotal case reports are valvular heart disease, mild to moderate valvular heart disease. There are specific formulations like Desmodium gangeticum, Muraria picta, Pseudocordifolia have all been recommended and are used by Ayurvedic physicians. And when it comes to usage of ghee and cholesterol, I mean ghee oil and cholesterol, Ayurveda has a very clear perspective, because Ayurveda is one of the earliest systems which very clearly explained that ghee or fat is both good and bad. Whether it is going to be good or bad depends on how your metabolic system is going to assimilate it. So the Ayurvedic focus has always been on correcting the metabolism, not focusing on, the fat and its role in producing heart disease. So hypertension is another problem which there are positive reports from clinicians in Ayurveda. I will go into some data and evidence specifics in the next slides. A variety of approaches ranging from medicines to procedures like Vasti. And again, what we have found is that we have done surveys with a lot of Ayurvedic clinicians. Even the Ayurvedic clinicians do not have one medicine or one treatment for hypertension. They recognize different types of hypertension. There are clinicians who are able to control hypertension with Vasti. There are clinicians who are controlling hypertension with Virechana. There are clinicians who use Shirovasti. There are clinicians who give internal medications. Some of them are herbs like Jadamansi, which work differently. Some of them are herbs like Arjuna. Some of them are like, if you try to look at it, you can find the renin-angiotensin system. Some of them work there. Some of them are ACE inhibitors. Some of them are beta blockers. So when you look at the practice, the Ayurvedic system seems to have a logic in understanding and differentiating different types of hypertension. And I think this is a rich area for further study. So, and of course, when it comes to research, it was Rauwolfia serpentina which was researched. And this is again the limitation. I mean, when you look at a drug, the focus is on one drug. And when we look at Ayurveda and hypertension, it's Rauwolfia that comes to our mind. But when you look at actual clinical practice, it's quite stunning to see the variety of approaches that are being employed. So, if you look at the herbs used in the management of heart disease, these are some of the herbs that have been very widely researched. So now the last part of my talk, I'd like to talk about what evidence we really have and what are the gaps. And I want to say that when it comes to research on Ayurveda, our biggest challenge is that we are simplifying complex interventions. So Ayurvedic treatment actually comes as a package of lifestyle, diet, and medical interventions. And this makes it quite challenging to design appropriate research studies. Like we did this study on rheumatoid arthritis with a grant from NIH. And it was the first study which looked at complex Ayurvedic treatment, as one package. It was a blinded, double-blind, randomized clinical trial. And when our study had just started, there was a systematic review on what Ayurveda has to offer for rheumatoid arthritis. One of the vehement critics of CAM, Dr. Edzard Ernst, wrote that systematic review in which he said that all available research to date shows that Ayurveda has nothing to do for rheumatoid arthritis. Either the study designs are at flaw, or if the study designs are rigorous, then the data is not convincing. So it was at that time that our study was done. And for the first time, our study showed that Ayurvedic treatment had a DMARD effect, a disease-modifying anti-rheumatic drug effect. And this was published, as was mentioned, in Annals of Rheumatic Diseases. And this is what I want to point out. It was a research methodology. Like Ayurveda was evaluated in the way it was practiced. Usually what happens is physicians do practice in one way, but when it comes to research, to fit the treatment into the research design, we simplify the treatment. We take one component, one drug, and then you will not see the efficacy. So, and in fact, Dr. Edzard Ernst, when our study was published, he wrote to us and he published a commentary on our study, which for the first time and the last time he has written anything positive about complementary and alternative medicine. And he said that this model could be used as a blueprint for future studies on CAM. So I just wanted to tell that, because when we look at the evidence that is available on Ayurveda and heart disease, we encounter the same problem. I mean, there are severe limitations in the research methodologies that have been used. And in fact, there is only one whole system trial, multi-model intervention, that evaluated the efficacy of Ayurveda and heart disease, and that is from the Maharshi group. All others are extremely fragmented, reductionistic studies. But they are still nevertheless interesting, so let's just have a quick look at them. So before that, I want to say that if you look at the available research, there's really a lack of a high impact study, and that is very much needed. If you look at rheumatoid arthritis, we have an NIH funded study which made an impact. If you look at elephantiasis, there's again a high impact study from the allopathic Dr. Narahari, which has resulted in a Cochrane review. And then there is osteoarthritis. Very recently in Charité Medical University, a very large trial just concluded. And this is just in the verge of being published, but the results are amazing. I mean, Ayurvedic treatment has shown very convincing efficacy in the management of osteoarthritis. So these can be considered as landmark studies. When you come to Ayurveda and cardiovascular disease, we are still not able to see any such study. So some studies are there, but still the studies that have already happened are quite complex and widespread. There are studies on composition of drugs, new formulations, trying to find ingredients in medicines that are already used. And then there are a lot of preclinical studies in animal models. In fact, if you look at the number of studies that have been conducted, clinical versus preclinical, it's the preclinical studies that are dominating. So some of the herbs, the Inula racemosa in experimental atherosclerosis, Terminalia arjuna on platelet activation, biochemical study on the protective potential of Nardostachys jatamansi, Aegle marmelos. So there are so many herbs that have been experimentally found to be helpful, in coronary artery disease at various levels. But the biggest problem is that they have not been translated into, well-formulated clinical studies. So this is one of the biggest problems. A lot of preclinical research in Ayurveda are not carried forward to the next stage. And although they give very promising results, they're not followed up on. So I tried to find out whether any of these formulations, very few studies actually went into a clinical phase, and there too from phase 2 to a phase 3 level. So this is the biggest problem. Research is really not moving forward. And so if you look at preclinical studies, again, I wanted to show is just that from single herbs to herbal formulations to patent medicines, all of them have been studied for their efficacy. Now, Abana is a drug manufactured by Himalaya and is widely used by Ayurvedic physicians. And there's another medicine called Hartone. So there's Aegle marmelos and Pushkaramula. Again, some of the herbs are more widely studied. So Arogya Vardhini Vadi is again a classical formulation, and Desmodium gangeticum, Terminalia arjuna. So what we see here is that preclinical studies have been basically drug-based, And they have looked at single herbs, classical formulations, and also modern formulations. But the biggest limitation is that they have not taken to the clinical study level. When it comes to clinical studies, there have been systematic reviews. We'll just look into that. Randomized control trials and quasi-experimental designs. It'll be interesting to see what these studies have revealed about the scope of Ayurveda and cardiovascular disease. There's just this one single multi-modality natural medicine program from the Maharshi group. Otherwise, most of the clinical studies are also just on single herbs or single formulations, never on the complete Ayurvedic treatment. So this multi-modal study is from the Maharshi group, and the reviews of studies, Terminalia Arjuna is one drug that has been studied very much, and this review is giving you a summary of all the previous studies and shows the gaps, especially that absence of phytochemical standardization, and clinical studies are poor in terms of design. So this is the problem that we find. And here